Hi everyone, it's Amy from Tanunda Physio. I'm here to take you through a few short videos that will help to educate you about osteoarthritis. What is it, how to live with it, and how we can help improve your life with osteoarthritis. Firstly, we'll start with the simple question of what is osteoarthritis, and then we will go through a few different dot points, the healthy joint, changes to the joint with osteoarthritis, commonly affected joints, why do we get osteoarthritis, and the diagnosis of osteoarthritis. So firstly, what is osteoarthritis or OA? It's a very common disease. It affects the whole joint, but most commonly affects the cartilage, so the articular cartilage. This articular cartilage degenerates and can become quite weak and fragile, can be because of a number of different things, being exposed to really heavy loads over a long period of time, so you're a labourer or something of that sort, or it can be that the cartilage is unhealthy and for some reason it can't handle normal loads. So osteoarthritis most commonly causes difficulties with mobility and disability in the older generation. It is quite common in the younger as well though, so approximately 5% of people between 35 and 54 years of age have osteoarthritis, and approximately 30% of people between 50 and 70 have osteoarthritis related problems. So if we talk about the healthy joint, a joint is any connection between two bones, so we have lots and lots of joints throughout the body. The ends of each of these bones are covered with cartilage. That cartilage creates a smooth surface when joints move freely. Within the joint we have what's called the articular capsule that surrounds the joint, and within that we have synovial fluid, so that's your oil part of the joint. It makes it move smoothly and it provides that nutrition that we need within our joints. The cartilage itself is what we call a shock absorber, so it has no pain sensors, no blood supply, so you can't actually feel pain within the cartilage, but we really need to load the joint so that we can provide the cartilage with good nutrition through the synovial fluid. So the way I like to think of it is that the cartilage is a wet sponge. When loads are applied, fluids are pressed out of the sponge. When loads are removed, the sponge sucks the fluids back in. So this happens with the fluid in and around our cartilage. So when we're loading it, that synovial fluid's getting pushed out into the joint, and when we unload it, the fluid sucks back into the cartilage. So this is why it's really important that we continue to have a healthy load on the joint so that we can provide the joint with good nutrition to give it the best chance of regenerating. So what changes happen within a joint with osteoarthritis? You may have heard of osteoarthritis described as wear and tear of the joint. This statement is actually incorrect because loads are still needed to keep a healthy cartilage. In a healthy joint, there is a balance between the regeneration and degeneration of cartilage. OA occurs when there is more degeneration, so that breakdown, then there is regeneration of cartilage. This causes the cartilage to thin, to crack, and sometimes it may disappear. Bones can start to rub against each other. However, cartilage needs a certain amount of load to regenerate. This is why healthy loads need to be applied on joints for cartilage recovery. So what joints are most commonly affected by OA? It's important to note that any joint that has cartilage can get osteoarthritis in it, but the three most commonly affected are your knee, your hip, and your hands. So if we talk about the knee, what you might feel is pain with weight bearing, so walking. You may have a stiff or unstable leg. Your knee may feel like it's giving way on you. You quite commonly will hear crunching or clicking noises. We call that crepitus. It may be hard to walk up and down stairs or get from sitting to standing. And sometimes you can get deformities in the knee, so looking like a knock knee or a bow leg. In the hip, so the hip's a tricky one because quite often the pain isn't actually in the hip itself. It can refer down into the knee. It's commonly deep inside the groin and sometimes on the inside or the outside of the thigh. Within the hip, you often feel very stiff, so you have that reduced range of motion in the joint. This can lead to having trouble getting in and out of a car, putting on your socks and picking up things from the floor. Often you walk with a bit of a funny gait, your step length will be shorter, and it may be hard for you to kind of straighten up. You'll feel like you need to be bent over when you're walking. And lastly, talking about the hand. So in the hand, you're most commonly talking about the tips of your fingers and the base of your thumb. Fingers may feel quite stiff and tender. You may get those deformities, so the little lumps on the ends of your fingers. And it's quite common for you to feel like you're really weak in your hands. It can be hard to make a fist or to open jars, things like that. Why do we get osteoarthritis? So this is quite a common question for us as physios, and we talk about it in two different areas. So there's non-modifiable risk factors. These are the things that we cannot change. So firstly is your age. So anyone over the age of 50 is at a greater risk of getting OA. But saying that, it can happen in anyone over the age of 30. That's generally early onset arthritis, that one. Your sex. So if you're female, you're more likely to get osteoarthritis than the males. Women are more likely to get it in the knees and the hands, whereas the men often get it in the hips more so. And your genetics, so delicate cartilage can run in the family, and if someone else in your family has had OA, then you are at a higher risk of getting it as well. Then we talk about the modifiable risk factors, so the things that we can actually change. Firstly is your weight. So obesity puts a lot more load on the joint. This can increase the risk of getting osteoarthritis in the knee particularly. However, we have found that people who are obese often have arthritis in their hands as well, so that's telling us that there's other factors to do with obesity that can cause OA, such as your metabolism. Physical inactivity, so this is quite self-explanatory, that little or no load on the cartilage is not enough for regeneration. So this happens when someone's not active enough. Cartilage needs that healthy loading in order for it to regenerate. Muscle weakness, so weak muscles don't provide proper support to the joint. This leads to more loads being applied to areas of cartilage that don't take weight well, can overload the cartilage and increase the risk of knee osteoarthritis in particular. Sports-related injuries. So half of the people with severe knee injuries, like your ACL tears, often from sports, they get OA later on in life, so 10 to 15 years later. Most people that hurt their knee as a teenager means that they may get OA in their 30s or later on. Top level sports can cause great loads on the whole body without allowing that regeneration, so this can also lead to that degeneration of cartilage. And lastly, our work or leisure time related joint injuries. So lots of people that load their body over a long period of time can end up with OA later in life. People who work as labourers, so farmers, firefighters, are more at risk of hip and knee arthritis, whereas teachers are more at risk of hand osteoarthritis. How do you know you have osteoarthritis? So quite commonly people will come into me with an x-ray that shows that they have bone on bone, and that's what they're here for. So quite commonly x-rays have been used in the past to diagnose osteoarthritis. We're trying to steer away from that now, because on an x-ray you'll quite often see the smaller joint space, the osteophytes, which is your extra bone growth, your cysts, which is your liquid containing cavities in the bone, and your sclerosis, so your hardening of the bone under the cartilage. This can come up on an X-ray or an MRI. However, despite these changes being there on an X-ray, you may not feel symptoms. Or on the other hand, you may have symptoms, but the changes may not show up on an X-ray for 10 to 15 years later. So we try and diagnose osteoarthritis based on symptoms. So what you're telling us, what we're finding in the joint, rather than using an X-ray to diagnose. So when a patient comes in to see us, we go through a set of questions and we come up with a clinical diagnosis. So osteoarthritis can often affect one joint and symptoms can progress slowly. Symptoms can start for no apparent reason. For some people, symptoms stop fully. For others, symptoms quickly turn into more serious problems and spread to other joints. Symptoms can come and go, so they're quite sporadic. Early symptoms are more commonly felt in the morning for long periods of time, so these include pain when moving or loading the joint. In time, pain can happen at rest or at night time as well. Getting that joint stiffness and problems starting your day, getting less range of movement, getting heat or swelling sometimes at the joint, you're getting muscle tightness and difficulty moving around. So you often hear people say things like they're having trouble putting their socks on, getting objects off the floor or squatting down. So it's really hard to predict what each person will experience with their osteoarthritis, but what we do know is that exercise works to help slow the increase of symptoms. Weight loss for people who are overweight will also help as well. And what we're doing now, educating people with osteoarthritis to really ensure that they understand their disease and can do the best things to help them.